over to you, Nishant sir.
Thank you, Saroj sir. Am I audible? मेरो आवाज सुन्नु भएको छ?
हजुर sir, yes.
Thank you, sir. Namaste, everyone. This is Nishant Lama, Associate Professor at School of Public Health, Karnali Academy of Health Sciences. Today, I'm going to talk about...
1 minute, sir. यो एकैछिन सर हाम्रो यो अगाडिको स्क्रिन चाहिँ शेयरिङ भइरहेछ कि तपाईको स्टार्टिङ गर्नु होला
स्लाइड हैन अर्कै आएर
यो
स्लाइड चाहिँ
स्लाइड शेयर भएको छैन सर हजुरको यो लोकल टेक्स्ट चाहिँ शेयर भइरहेछ
फाइल ओपन गर्नुपर्छ होला हजुरले
अहिले देखियो
ओके अब स्लाइड शोमा गर्नुभयो भने
भयो
स्लाइड शो
बाल छैन
स्लाइड चाहिँ देखियो स्लाइड
शो चाहिँ भएन स्लाइड त आयो
F5 गरे आउँछ त्यहाँ
अहिले भयो
हजुर यस
भयो थ्यांक यू
भयो
पुनः नमस्कार सबैजनालाई today I am going to share my study on determinants of maternal mental health status and their association with acute malnutrition among children admitted in nutrition rehabilitation homes of Karnali province, Nepal. भन्ने शीर्षकमा म प्रेजेन्ट गर्न गइरहेको छु मेरो टिम मेम्बरमा I have Associate Professor Prem Prasad Panta, Assistant Professor Srijana Kesi, Assistant Professor Monica Lama, and Assistant Professor Dr. Rajendra Manigiri हुनुहुन्छ. So here I go. I would like to remind all of you that acute malnutrition is a severe form of is a life-threatening form of undernutrition, and it has been one of the major cause or principal cause of morbidity and mortality among under 5 children in the globe, and it has also been found to have greater association with higher risks of cardiometabolic NCDs, and it has also been found to promote intergenerational poverty as well, intergenerational malnutrition as well. And globally, we can see that 6.7% of under 5-year children are acutely malnourished, and among them, 70% lives in Asia. According to Nepal Demographic Health Survey 2016, it has shown that prevalence of acute malnutrition is 10% in Nepal, and among them 2% are severely acute malnourished. Whereas the recent Nepal Demographic Health Survey 2022 revealed that the prevalence of general acute malnutrition is 8% in Nepal. Now talking about maternal mental distress, globally 13% of mother has experienced maternal mental distress. Meta-analysis have also shown that 20% of mother in developing countries have felt clinical depression after childbirth. Yes, Nepal government has been trying to address this acute malnutrition by applying several kinds of nutrition programs. However, this acute malnutrition has remained still a constant challenge to our government. As we know that this maternal mental health and nutritional status, especially acute malnutrition, both are alarming public health problem. And we know nutritional and socio-emotional quality of care of children is determined by caregivers or mother's mental health status. However, this maternal mental health is neglected in child nutrition programs of low and middle income countries like Nepal. As we have done this study in Karnali Academy of Health in Karnali province, this Karnali province has been taken because it has housed large number of malnourished children in Nepal, and this province is also food insecure province, have high violent incidents and have higher general stress at home among adults. So that's why we assume that there may be prevalence of maternal mental distress, and that may have aggravated the prevalence and severity of acute malnutrition in children in the province. And there was also limited evidence in Karnali province in this issue. That's why we aimed at determining determinants of maternal mental health status and their association with severity of acute malnutrition among children admitted in nutrition rehabilitation homes of Karnali province, Nepal. To achieve this now objective, we have designed institution-based cross-sectional study using quantitative method, and we have taken all the nutrition rehabilitation homes of Karnali province. There are total 3 nutrition rehabilitation homes, and one is in itself in Karnali Academy of Health Sciences, Jumla, and another one is in Dailik district, and the next one is in Surkhet district. And from these 3 nutrition rehabilitation home, we selected total 105 mother and child diet for our study, and this sample size was taken using disproportionate sampling. We used face-to-face interview with our participants, and we also did secondary data review. The tools like WHO SRQ20 and HFIAS scale. Along with that, we have also used the tools used by Nepal Demographic Health Survey to identify intimate partner violence. And we have done descriptive as well as inferential analysis. So we have followed the ethical principles throughout our study, and we have taken this clearance or ethical approval from IRC Karnali Academy of Health Sciences, Jumla. Now talking about our findings, this maternal mental health status was measured by using WHO SRQ20, where there are 20 items, and a response of each item was scored, and the positive response was given score 1, and the negative response was given 0. And we have computed median value of that score, and the 7 was the median value. So we determined that more than or equal to mothers having more than or equal to 70 scores were considered as having mental distress, and less than that was considered as having no mental distress. So in our study, we found that 34.3% of mother had mental distress. Similarly, severity of acute malnutrition among under 5 children, those who were admitted in nutritional rehabilitation homes of Karnali, there we found that 30.5% of children were having moderate acute malnutrition, and 69.5% had severe acute malnutrition. Now, from bivariate analysis, we found that household food insecurity or household food security had no association with maternal mental distress. However, physical intimate partner violence, sexual intimate partner violence, and emotional intimate partner violence had statistically significant association with maternal mental distress. Similarly, maternal mental distress was not found to have association with severe acute malnutrition, severity of acute malnutrition. However, the data has revealed that larger or greater percentage of severely acute malnourished children belong to mothers having mental distress, and mothers being the victim of emotional intimate partner violence had also a statistically significant association with severity of acute malnutrition. And age of the child, food frequency, frequency of cereals or roots or tubers consumed, frequency of pulses and legumes, and frequency of vegetables consumed also had a statistically significant association with severity of acute malnutrition among children. So we conclude that more than 1/3 of mothers had mental distress, and different forms of intimate partner violence had association with maternal mental distress in Karnali province. And the presence or absence of this maternal mental distress had impact on severity of acute malnutrition in children. Mothers being the victim of emotional intimate partner violence, and age of the child, and frequency of diversified food consumed also had a statistically significant association with severity of acute malnutrition, as literatures have shown that maternal mental health has a relation with the caring, rearing, and child growth and development, we suggest here that maternal mental health services should be tailored in the current nutrition programs and health services, and intimate partner violence should be discouraged and prevented to prevent the acute malnutrition among children in Karnali province. Age-specific and diversified food frequencies of complementary feeding should also be promoted, and we suggest to do a large sample size study to generalize these findings throughout the nation. With this, I would like to acknowledge my Vice Chancellor of Karnali Academy of Health Sciences for connecting me with NIRI team, and I would also like to thank the NIRI team for creating such an wonderful platform to share our work, and all the participants over here who are passionately listening or passionately participating in this symposium. Thank you so much. Thank you.
Thank you so much, Nishant sir, for your presentation. Nishant sir को लागि क्वेशनहरु अब हामी वेलकम गर्न सक्छौं। हामी समयमै छौं।
च्याटमा क्वेसन छ है।
जगतमान तामाङ सरले सोध्नु भएको छ, व्हाट अबाउट द ओभरअल स्ट्याटस अफ नेपाल सर भन्नुभएको छ। आई थिंक ओभरअल स्ट्याटस अफ मैटरनल मेन्टल हेल्थ कन्डिसन होला। त्यस्तै गरी दिनेश गौतमजीले सोध्नु भएको छ, व्हाट इज द डेटा अफ मुसर, चामर एन्ड डोम कम्युनिटी, आर एनीवन वर्किङ डियर कम्युनिटी भन्नुभएको छ। र डाक्टर ओम कुर्मीबाट क्वेसन आएको छ। मैले एकैचोटि क्वेसन भने सो द्याट एन्सर गर्न सजिलो होस् भनेर। Can you please tell more about the types of micronutrient consumption in pregnant women? What about the micronutrient such as omega-3 fatty acid consumption, etc.? Over to Nishant sir.
Thank you so much for these wonderful questions, queries. I would like to say that as my study do not cover all these questions. However, being a public health professional, I would like to say that currently micronutrient deficiency is really a problem in our context, in Nepalese context. Especially dietary diversity is low in our context. As dietary diversity is low, we can say that there may be prevalence of micronutrient deficiencies. For example, we can say that still more than 30% of women and pregnant women in our Nepal are having iron deficiency anemia. So there are also other deficiencies. Similarly, here I can see that what's about Musar and Samar. These group of people are the disadvantaged group in our Nepal. So we can say that there may be prevalence of this acute malnutrition and other nutrition related problems in those communities as well. So I think I have tried to address your queries. That's it. Thank you.
मैले डाक्टर पुष्पराज पन्त सरको ह्यान्डल्स देखेको छु, त्यसपछि डाक्टर तारा सुब्बा। पुष्प सर।
Thank you, Saraji. Thank you, Nishantji, for such a wonderful presentation. Actually, I would just like to add a few things because when we were approaching, you via VC sir, Dr. Rawal, we were talking like, okay, this study is about nutrition and malnutrition, and how we fit this in a symposium that is about non-communicable diseases. But we found out, we know that there is a gap of information to tell about to the people that, the severe malnutrition in childhood may have, the strong association with non-communicable diseases in the later age. We just wanted to add, and may you have something to add more on it, and I would pass it to Tara sir if you have nothing to add. Thank you.
Yes, thank you, Pushpa sir. Yes, studies have shown that those children who have acute malnutrition, there is higher risk of developing these NCDs or cardiometabolic NCDs in later period of life. So there are lots of evidence on this. That's why nutrition during childhood should be addressed as soon as possible. So we consider first 2 years of life as a golden opportunity to address, to prevent the lifelong consequences of this acute malnutrition. Thank you.
Thank you, Pushpa sir. Tara sir.
हजुर निशान्तजी एकदमै राम्रो लाग्यो हजुरको प्रेजेन्टेसन एकदमै टाइमली रेलेभेन्ट छ। अब हामी यो युएसतिर अथवा नेपालमा पनि सहरतिर के भएको छ भने ओभर इटिङ ओभर अबन्डेन्स अफ फुडले चाहिँ कार्डियोभास्कुलर किडनी डिजिजहरूलाई इम्प्याक्ट गरेको छ होइन, कन्ट्रिब्युट गरेको छ भने अब हजुर जहाँ हुनुहुन्छ त्यहाँ चाहिँ मालन्युट्रिसनको कुरा भयो। मैले यो अकाडेमिया असाइड मैले हजुरलाई सोध्न खोजेको अब ग्रिन भेजिटेबलको सप्लाई कर्णालीमा मैले हजुरले एज अ पर्सन हु इज लिभिङ देयर कस्तो पाउनुहुन्छ? उनीहरूलाई केही त्यस्तो गभर्मेन्ट साइडबाट अथवा अरू साइडबाट केही हेल्प छ, सपोर्ट छ उनीहरूको त्यो न्युट्रिसनलाई ब्यालेन्स गर्नलाई? हजुरको मैले खालि पर्सनल अब्जर्भेसन मात्रै सोध्न खोजेँ।
हुन्छ तारा सर, थ्याङ्क यू सो मच फर दिस वन्डरफुल क्वेसन। अब कर्णालीको कन्टेक्स्टमा हामीले हेर्ने हो भने चाहिँ अब विशेष त यो भेराइटिज अफ फुड आइटम्सहरू पाउनु, डाइभर्सिफाइड फुड पाउनु भनेको इट्स अ भेरी च्यालेन्जिङ थिङ। रिसेन्टली अब हामी केही वर्ष यता चाहिँ हेर्न सक्छौँ कि यो अब यातायातको सहजताको कारणले गर्दाखेरि अहिले चाहिँ डाइभर्सिफाइड फुडहरू पनि हामी पाउँछौँ होइन। त्यो हिसाबले गर्दाखेरि अलिकति डाइभर्सिटी चाहिँ बढेको छ स्टिल, बट देयर इज स्टिल मोनोटोनस डाइट। अब भिलेजतिर हामी हेर्ने हो भने चाहिँ अब सदरमुकाममा हेडक्वार्टरसम्म चाहिँ अलिकति डाइभर्सिफाइड डाइटहरू भए तापनि गाउँघरतिर चाहिँ स्टिल मोनोटोनस डाइट छ। सो त्यो छ। त्यो सँगसँगै गएर चाहिँ अहिले देयर आर लट्स अफ एनजिओज, आइएनजिओज हु आर वर्किङ टु क्रिएट to cultivate green vegetables using के भन्छ हामी त्यसलाई using this ग्रिनहाउसहरू बनाएर चाहिँ कल्टिभेट गर्नको लागि चाहिँ उहाँहरूले सहयोग गरिराख्नु भएको छ। सो त्यसबाट पनि चाहिँ प्रोडक्सन्सहरू चाहिँ भइरहेछ, तर यहीँको प्रोडक्सनले मात्र चाहिँ इनफ छैन भन्ने कुराहरू चाहिँ डेटाहरूले हामीले आफैले पनि अनुभव गरिरहेछौँ। जस्तै अब कतिपय सिजनहरूमा चाहिँ वी डु नट गेट भेराइटिज अफ कि त यो ग्रिन लिफी भेजिटेबल्सहरू चाहिँ हामी भेराइटिज पाउन सक्दैनौँ। सो त्यस्ता लिन सिजन्सहरू पनि छन्। सो त्यसलाई नै अहिले एड्रेस गर्नको लागि चाहिँ गभर्मेन्टले अब पालिकाहरूले चाहिँ यो किसानहरूलाई चाहिँ यो ग्रिन हाउसको लागि चाहिने सामग्रीहरू चाहिँ पालिकाहरूले पनि दिने गरिरहेको छ। सो त्यसले चाहिँ प्रमोट गरिरहेछ। अनि अब यो चाहिँ फुड इन्सेक्योर डिस्ट्रिक्ट भएको कारणले गर्दाखेरि, प्रोभिन्स भएको कारणले गर्दाखेरि चाहिँ यसमा हामी के पनि देख्छौँ त भन्दाखेरि गभर्मेन्टले अब एफएओको सपोर्टमा चाहिँ चाहिँ यो पोसिलो पिठोहरू चाहिँ वितरण गरिरहेछ। सो यसरी पनि चाहिँ एड्रेस यहाँको चाहिँ न्युट्रिसनल निड्सहरू चाहिँ एड्रेस भइरहेछ। थ्याङ्क यू।
थ्याङ्क यू सो मच निशान्तजी।
थ्याङ्क यू तारा सर फर द क्वेसन। म नम्रता राउत म्यामबाट क्वेसन दिन चाहेँ। ए ओके okay ma'am, I think
Thank you. Amazing talk, Dr. Lama. There are some intriguing facts, and as usual, those are alarming numbers. मेरो क्वेसन चाहिँ हजुरलाई यो छ, हजुरले जुन त्यो डेटा कलेक्ट गरिसकेको छ त्यो पेसेन्ट जुन भिजिट गर्छ हस्पिटलबाट त्यहाँबाट हो कि you also reached out to some other volunteer? अनि second part question चाहिँ we know mental health is also getting alarming in the kids. So did you frame that time window for the kids that you were selecting for this one? What was the time window?
Okay. Thank you, ma'am, for your wonderful question. So we have taken our cases from nutrition rehabilitation homes of Karnali, and we have just assessed the mental health status of mothers only. So we did not assess the mental health status of that children. I think I have addressed. Thank you.
Thank you, Naman for the question and Nishant sir for the answer.
Thank you. Thank you.
मैले कौशल सरको ह्यान्डरेज देखिरहेको छु तर हामी समयभन्दा अलिकति नागिसकेका छौँ सो यदि मिल्छ भने आई थिङ्क च्याटबाटै कम्युनिकेसन गरौँ होला
Sure, sure.
ओके